Imagine this. You're over 60, feeling fine, maybe even proud of your morning walks. You don't smoke, you eat fairly healthy, and your blood pressure seems okay. But one day, you notice something small. You feel unusually tired climbing a short flight of stairs. Or maybe your ankles swell a little at night. You brush it off. That's just aging, you tell yourself. But what if those little signs were actually your heart whispering for help long before any real pain begins? According to Harvard Medical School, over 45% of heart attacks in adults over 60 occur without the classic chest pain. No crushing pressure, no sharp stabbing feeling. Just quiet, subtle warning signs that most people ignore until it's too late. The truth is, heart disease rarely strikes out of nowhere. It builds silently through symptoms so mild that they seem harmless. Fatigue, indigestion, shortness of breath, jaw discomfort, or even sleep issues. And yet, recognizing these early red flags could literally save your life. The American Heart Association estimates that catching early heart disease increases survival by 80%, compared to waiting for major symptoms. So, in this video, we're going to uncover the 7 silent signs of heart disease after 60 that you should never ignore, and what doctors say you can do right now to protect your heart, your independence, and your future. Here's what's coming up. The surprising connection between fatigue and oxygen-starved blood. Why ankle swelling could mean more than just salt retention. The hidden danger behind shortness of breath during simple chores. The overlooked link between jaw pain, sleep troubles, and heart rhythm. And simple science-backed habits you can start today to reverse risk. Because your body is always talking, you just have to learn to listen. And once you understand what it's saying, you can stop small problems before they become emergencies. Before we begin, I want to remind you, this isn't medical advice. It's life-saving education backed by real studies from Harvard, Mayo Clinic, and Johns Hopkins. And if you've ever felt off but couldn't explain why, this video might help you connect the dots. Let's start with silent sign number 1, the one most seniors mistake for just getting older. Silent sign number 1, unusual fatigue that comes out of nowhere. It's 2 p.m. and you've done nothing strenuous, but suddenly you feel like you've run a marathon. You sit down, catch your breath, maybe take a nap, and feel better.
Seems harmless, right? Not always. A 2023 study from the Mayo Clinic found that over half of seniors diagnosed with heart disease first noticed episodes of unexplained fatigue months before diagnosis. Here's why. When your arteries start to narrow, your heart has to work harder to push oxygen through your body. That lack of oxygen makes your muscles and even your brain feel exhausted faster than normal. What's tricky is that this kind of fatigue isn't fixed by rest. You might wake up tired, feel drained after light chores, or lose motivation for daily walks. Doctors say if your energy drops sharply for more than a week without changes in sleep or diet, it's time to ask for a heart screening. Simple blood tests, an ECG, or a stress test can reveal issues early, long before a major event. Now let's move to silent sign number 2, one most people literally see every day and still overlook. Silent sign number 2, swollen ankles or feet, especially at night. You take off your shoes at the end of the day and notice faint sock marks or puffiness around your ankles. You tell yourself, it's probably just water retention, or I stood too long today. But here's what most people don't realize. Chronic swelling, known as edema, can be one of the earliest outward signs of heart failure. When your heart weakens, it can't pump blood efficiently. Fluid starts pooling in the lower parts of your body, especially around the ankles, feet, and calves. This happens even before chest pain begins. According to the Cleveland Clinic, around 70% of seniors with early-stage heart disease experience some level of swelling before diagnosis, but only 1 in 5 report it to their doctor. You might also notice rings or watches fitting tighter, pants feeling snug around the lower legs, weight gain of 2 to 3 pounds in a few days. Here's what you can do. If you notice persistent swelling for more than 3 to 4 days, weigh yourself every morning at the same time. A sudden increase in weight, more than 2 pounds overnight, could mean your body is retaining fluid. This small daily habit can help your doctor catch early heart dysfunction before it becomes serious. Silent sign number 3, shortness of breath during everyday activities. Maybe it happens when you climb stairs or when you bend over to tie your shoes. You suddenly feel winded faster than you used to, and it takes a moment to recover. Most people assume it's just being out of shape.
But doctors at Johns Hopkins University warn that unexplained shortness of breath, dyspnea, is one of the most underdiagnosed symptoms of early heart disease. When your heart can't pump blood efficiently, oxygen delivery to your lungs and muscles drops. You start breathing faster to compensate, and that's why you feel winded. A 2022 study from the National Heart, Lung, and Blood Institute found that seniors with mild shortness of breath were 4 times more likely to develop heart failure within 5 years, even if they had no other symptoms. So here's a simple self-test. Try talking while walking up a short flight of stairs. If you can't finish a sentence without pausing for air, it's time for a cardiac checkup. Sometimes, shortness of breath also appears when lying flat at night, a condition called orthopnea. If you find yourself propping up pillows to breathe comfortably, don't ignore it. Your heart may be struggling to circulate blood efficiently while you're resting. Silent sign number 4, jaw, neck, or upper back discomfort. This one surprises almost everyone, especially women. Heart pain doesn't always strike in the chest. In fact, Harvard Women's Health Watch reports that up to 42% of women over 60 experience referred pain in the jaw, neck, or upper back during early heart distress. Here's why. The nerves that connect your heart also branch into your jaw, neck, and shoulders. When your heart sends pain signals, your brain can misinterpret their origin, a phenomenon called referred pain. You might feel a dull ache under your jawline, pressure in your throat or between the shoulder blades, a sense of tightness or heaviness when you exert yourself. Unlike muscle pain, these sensations don't improve with stretching or massage and may come and go unpredictably. Practical tip. If this discomfort appears during emotional stress or mild exertion, like walking or lifting groceries, note the pattern. Tell your doctor exactly when and how it occurs. A simple stress echocardiogram can reveal if your heart is the real source. Now, let's move to the next set of signs, the ones that are even more deceptive because they often appear in your sleep and digestion, not your chest. Silent sign number 5, persistent indigestion, nausea, or stomach discomfort. Many people are shocked to learn that heart trouble can start in the stomach. You may feel bloated after eating, experience mild nausea, or a dull ache in your upper abdomen, and assume it's acid reflux, gas, or something you ate. But according to research from the Mayo Clinic, these symptoms can actually occur when the heart is not getting enough oxygen. During early cardiac distress, reduced blood flow can trigger signals in the vagus nerve, the same nerve that connects your heart to your digestive tract. The result? Symptoms that feel like indigestion but are actually early heart warnings. A Harvard study found that 1 in 3 older adults who later suffered a heart attack reported having upset stomach or heartburn-like pain within the previous month and dismissed it as digestive trouble. How can you tell the difference? If your discomfort comes with cold sweats, fatigue, dizziness, or shortness of breath, it is not a stomach issue. It could be cardiac. If these symptoms appear repeatedly after mild exertion or emotional stress, contact your doctor immediately. Doctor tip: avoid self-medicating with antacids if your heartburn feels different, deeper, or radiates to your jaw or arm. A quick ECG or blood test could reveal early coronary disease before serious damage occurs. Silent sign number 6, disrupted sleep or nighttime anxiety.
You wake up in the middle of the night gasping for air or feeling restless for no reason. You can't quite explain it, but your body feels uneasy. Doctors now know that this can be an early neurological sign of heart trouble. A 2023 Johns Hopkins study revealed that people over 60 with frequent nighttime awakenings or unexplained anxiety during sleep had a 54% higher risk of developing heart disease within 5 years. The reason is physiological. As the heart struggles to maintain oxygen flow, your nervous system triggers a fight or flight response to wake you up. This can appear as mild panic, shallow breathing, or even nightmares. If you regularly wake up gasping, sweating, or anxious, it's important to get evaluated for sleep apnea, a common but silent contributor to heart strain in older adults. Treating sleep apnea with devices like CPAP or through weight management and breathing exercises can dramatically reduce nighttime cardiac stress. Lifestyle insight. Try sleeping slightly elevated, practice slow nasal breathing, and avoid eating large meals within 2 hours of bedtime. These small changes reduce pressure on your heart and help maintain steady oxygen flow through the night. Silent sign number 7. Irregular heartbeat or fluttering sensation. Every once in a while, your heart seems to skip a beat or suddenly races for a few seconds. You might feel it in your chest, throat, or even your ears. Many seniors shrug this off, thinking it's harmless. But new research from the Cleveland Clinic shows that even mild irregular heart rhythms, known as atrial fibrillation, AFib, can increase stroke risk 5-fold and often appear years before diagnosis. This irregular rhythm means your heart's electrical system is misfiring, causing uneven contractions. Sometimes you'll feel dizzy, weak, or notice a faint pulse difference. Other times, it's so subtle you only sense something feels off. If this sensation lasts more than 30 seconds or happens several times per week, get it checked. A simple wearable ECG patch or home monitor can detect AFib episodes early, and modern medications or ablation procedures can prevent future heart failure and stroke. Pro tip: limit caffeine, alcohol, and dehydration, all of which can trigger irregular rhythms. Add magnesium-rich foods like spinach, almonds, and avocado to support heart electrical function naturally. The science behind the silence. The National Institutes of Health explains that as we age, pain signals from the heart become less intense because nerve sensitivity declines. That's why seniors often experience silent heart symptoms. The heart is struggling, but the brain doesn't register traditional pain. Instead, the body sends clues through fatigue, breathlessness, and sleep disturbance. The good news? The same research shows that once these early signs are recognized, simple lifestyle changes like moderate daily movement, improved sleep, hydration, and stress management can reduce heart risk by over 60% in adults over 60. Now that you know the 7 silent signs, let's talk about how to turn awareness into prevention, the habits that protect your heart every single day. Recap and reflection. Let's review what we've learned today. Heart disease doesn't always announce itself with pain or drama. Sometimes it whispers through fatigue, swelling, breathlessness, or even poor sleep. These are not random inconveniences. They are messages from your body. Science now confirms what doctors have long suspected. Your body sends warnings weeks or even months before a major cardiac event. Those who listen early have dramatically higher survival and recovery rates. If you've noticed any of these silent signs, unusual tiredness, ankle swelling, jaw or neck discomfort, disturbed sleep, or irregular heartbeat, don't ignore them. Schedule a heart screening. Most tests are simple, non-invasive, and can detect early-stage problems before they become life-threatening. Remember, prevention isn't about fear, it's about freedom. Freedom to keep walking, laughing, and living without worry. Recap and reflection. Let's review what we've learned today. Heart disease doesn't always announce itself with pain or drama. Sometimes it whispers through fatigue, swelling, breathlessness, or even poor sleep.
These are not random inconveniences. They are messages from your body. Science now confirms what doctors have long suspected. Your body sends warnings weeks or even months before a major cardiac event. Those who listen early have dramatically higher survival and recovery rates. If you've noticed any of these silent signs, unusual tiredness, ankle swelling, jaw or neck discomfort, disturbed sleep, or irregular heartbeat, don't ignore them. Schedule a heart screening. Most tests are simple, non-invasive, and can detect early-stage problems before they become life-threatening. Remember, prevention isn't about fear, it's about freedom. Freedom to keep walking, laughing, and living without worry.